The next neurodegenerative disease will be a Huntington's disease. Huntington disease, here you are going to have trinucleotide repeat. It was an example of trinucleotide repeats, right? So here the repeats will be of CAG. So the gene involved here will be Huntington gene, chromosome 4p. So the Huntington gene, in the Huntington gene, you are going to have the repeats of this CAG. So I remember it like this: the hunter is going to take a bag and go for putting his pouch. So CAG and bag sound similar. So that is how I remember. So CAG repeats are going to be present in Huntington gene. And here, normally the repeats are allowed up to 35 copies. So normal limit is 6 to 35 copies, and more than 35 copies of repeats are going to cause this Huntington's disease. And here again, like in any trinucleotide repeat mutations, there is going to be the phenomenon called as anticipation. That is, as the generation progresses, it is also an autosomal dominant disease. So as the generation progresses, suppose the father is presenting at the age group of 40 to 50 years, and then the next, his son will present at an earlier age group. He'll present at around 30 to 25 years itself. Okay. So this kind of anticipation can be expected in Huntington's disease. And that is also, we had already discussed about it in Fragile X syndrome. So here the age of the onset normally is 30 to 50 years. And the patient usually presents with chorea, as the name suggests, Huntington's chorea or Huntington's disease. So here the patients will have involuntary movements like chorea, and later on only the neural cognition dementia will start forming. So till then it is all muscular movements are affected, then later on only cognition is affected. And here the part of the brain which is involved will be the caudate nucleus and putamen, which are together called as the striatum. So basal ganglia, caudate and putamen is going to be atrophied in Huntington's disease. And here also you can have intranuclear inclusions or composed of this Huntington and ubiquitin protein. So the inclusion here will be intranuclear. Usually the patients die within 15 years. Then the next neurodegenerative disease is amyotrophic lateral sclerosis. It is a motor neuron disease in which there is going to be both upper motor neuron and lower motor neuron defect. So this is very important, and it is an autosomal dominant disease. And here the mutations will be involving the SOD1 gene. So SOD1 stands for superoxide dismutase. So superoxide dismutase, we all know it is an antioxidant enzyme, right? Superoxide dismutase. So it has two forms, manganese form and the copper zinc form. So manganese form was the M for M, so membranous form. Copper zinc form is the cytoplasmic, C for C, so cytoplasmic form. So this cytoplasmic copper zinc form is the one which is getting mutated in ALS, which is amyotrophic lateral sclerosis. And one other thing is this superoxide dismutase is going to be the most important antioxidant in the brain. That is why its mutation is directly going to cause a disease. So when there is misfolded, this mutation in SOD gene can cause the formation of misfolded proteins, which can again result in apoptosis. So most of the neurodegenerative disorders are going to result from either an impaired autophagy or an impaired protein folding. So any misfolded protein will always result in accumulation and causing death by apoptosis. So here the inclusions bodies which we see in amyotrophic lateral sclerosis will be Bunina bodies. So these are intracytoplasmic pinkish bodies, eosinophilic intracytoplasmic inclusions called as Bunina bodies, which are going to be positive for periodic acid SIF. Next, we'll see about Prion's disease. Prion's disease is very, very important in MCQ point of view. So, do read it at the last minute also. So, Prion's disease, every word you must remember here. So, it is a rapidly progressive dementia disease which is transmissible and it has a longer incubation period. So, all of these words have been used in the options given below for Prion's disease. So, remember, it is a rapidly progressive transmissible disease which causes dementia, and this disease is going to have a longer incubation period. And the most common cause of this Prion's disease is it is transmissible, right? So, the transmission is done by iatrogenic means, usually by neurosurgery. So, during neurosurgery or during corneal implants. So, corneal implants from cadavers, they keep it. So, if that patient had died of some Prion's disease which had gone undetected, then if you are taking and implanting that cornea into the patient, it is going to result in the Prion's disease in the recipient also. And here again, the pathogenesis is going to be misfolded protein. So, normally also we have Prion's protein which are PRPC. So, PRPC is the normal Prion protein which misfolded, it is going to be called as PRPSC. So, PRPSC is going to be resistant to protease destruction. So they are not going to be resistant, so they are going to accumulate and cause problem. So normal protein is going to have an alpha helix structure, while PRPC is going to have a beta pleated formation. Beta pleated sheets will be formed like that of an amyloid. Okay, so the various prions diseases we know about are Creutzfeldt-Jakob disease, which is the most common one. Other than that, we have Jesman-Straussler-Schinker syndrome, Kuru disease, Scrapie, mad cow disease, Minks transmissible encephalopathy, and fatal familial insomnia. So on microscopy in prions disease, the classical feature we see will be a spongiform neurons. So these are nothing but grape-like vacuoles. So cluster of grape-like vacuoles will be present inside the neurons. So in this image also, if we appreciate, all of this small spongiform appearance of the neurons is there. It's all vacuolated. So this is the classical image, and this image has been asked in MCQ also before. So this is the image of a prions disease. And one important thing to remember about this is this spongiform neurons are not going to be present in fatal familial insomnia. So one of the prions disease was fatal familial insomnia. So this FFI is not going to show any spongiform neurons. That is also a question. And inflammation is going to be characteristically absent in prions disease. Other than that, in Kuru disease, which is also another prions disease, you can see some Kuru plaques. So these structures which are pinkish and extracellular, right, like a mop it is appearing. So these kind of structures are called as Kuru plaques, and these are aggregations of the abnormal prion misfolded protein seen in Kuru disease. So till now we had seen about the various neurodegenerative disorders also. So let me recap about the inclusions here. So in Alzheimer's, we saw about the Hirano bodies, which were eosinophilic rod-shaped bodies. So Alzheimer's disease, eosinophilic rod-shaped bodies in the cytoplasm. Then we saw about the Pick's bodies. Pick's bodies seen in Pick's disease, which is again globular eosinophilic intracytoplasmic bodies. So this is seen in Pick's disease. Then we saw about Huntington's disease. Again, there will be Huntington protein which is forming the intranuclear inclusion. Here the inclusion will be intranuclear. Right. Then we had Bunina bodies. Bunina bodies are again eosinophilic small dot-like inclusions seen in amyotrophic lateral sclerosis. Then we saw about Lewy bodies. So Lewy bodies we see it in Parkinson's disease. So it is going to be composed of alpha synuclein, and it is going to have a halo around it. Okay. So Hirana bodies actually were composed of actin. Okay. Then Negri bodies, though it is not a neurodegenerative disorder, it is seen in rabies infection, and here you are again going to see an intracytoplasmic eosinophilic inclusion. Okay, these are the various inclusions you need to remember about.